Hey guys, just a reminder, this is not official medical advice. For such, please seek an appointment with a licensed medical provider.
Hi, this is Dr. Tom Rogers coming to you today with the Common Sense MD, the weekly podcast that I do. Occasionally, I will read a book, order a book, read it, simplify it for those that are listening. And I ran into one last week I really wanted to do a podcast on. It just caught my eye. It's called The Parkinson's Plan. It's written by two well-known neurologists who specialize in Parkinson's disease. It has a lot of great testimonies, and really the reason that I wanted to bring this book to you was to develop a plan to prevent Parkinson's disease. And I'll tell you why. Because this is not something that just happens to you by luck, bad luck. It's certainly not a genetic disease. Now, I'm going to talk a little bit about that. But in any event, it's called The Parkinson's Plan, A New Path to Prevention and Treatment. And I thought it was just fascinating. A couple statistics. Every 6 minutes, an American is diagnosed with Parkinson's disease. And I've seen this in my practice. I don't know why, but ever since COVID, I've seen a lot of Parkinson's disease. And we're always thinking about how to treat this, and we don't talk about prevention much, but it is a preventable disease. It's a man-made disease is what it is. So every 6 minutes, an American is diagnosed with it. And every day, 100 Americans die of Parkinson's. Parkinson's is now the world's fastest-growing neurodegenerative disease. Think about that. By far. Way more fast-growing than Alzheimer's disease. And like I said, it's not hereditary. Although there's certain genetic predispositions for that, as well as anything, it's thought to be less than 15% of people that have Parkinson's have any hereditary gene involved in this. It's tied to chemicals in our food, water, and air. This is a fairly new disease. It was discovered by an English doctor, James Parkinson, in 1817. It used to be rare. Industrialized England at that time was more air polluted than modern-day New Delhi, India. And that's bad. Nowadays, it's not just in the air, it's in the food and water. Mostly because of pesticides. If you live on a golf course, you're way more likely to get Parkinson's disease. Interesting. I'm going to talk about initial symptoms. I'm not going to talk too much about treatment or symptoms of Parkinson's today. I'm going to talk about prevention. But the initial symptoms can be vague. And a lot of the times, people have had Parkinson's disease. When it manifests, it's usually been going on for a while. Kind of like Alzheimer's, usually been going on a long time before you realize that a patient has it. But the initial symptoms can be anywhere from mild constipation, urinary urgency, loss of smell, which we saw a lot during COVID, sleep disorders, decreased facial expression. They have that, what we call masked faces, facial expressions gone, depression and anxiety, fatigue, drooling, pain, impaired thinking, of course, tremor, which is a pill-rolling type of tremor, and a shuffling gait, and it's progressive. The cause is a loss of nerve cells in a part of your brain called the substantia nigra that produces dopamine. We do a lot of work with hormones. We talk about all kinds of hormones, not just estrogen, testosterone, progesterone. We talk about insulin. We talk about vitamin D. We talk about thyroid. We talk about cortisol. We talk about dopamine, one of those neurotransmitters that's involved in reward, pleasure. Everybody wants a dopamine hit. But dopamine is not only responsible for reward and pleasure, it's also involved in motor control. and that's where it hits Parkinson's. The remaining nerves that are left when this thing strikes are really clustered in garbage bags called Lewy bodies. So Lewy body dementia, which is worse than Alzheimer's, I think, in the patients I've seen, it's a form of Parkinson's. I never knew that before I read this book. See, we're always learning. This is a man-made disease, just like I told you. Genes don't change much in 200 years. We didn't see this disease 200 years ago. And it's not a natural consequence of aging, although it's more common as you age. It takes a while for this stuff to get you. Symptoms are, or should I say Parkinson's, is 5 times higher in industrialized countries. So you know it's related to pollution of some type. Think about Agent Orange in Vietnam, the burn pits of Afghanistan, the contaminated water at Camp Lejeune, North Carolina, that you read so much about. Think about DDT. Think about that weed killer called paraquat, the use. Think about dry cleaning. One main lesson I learned out of this book is stay away from dry cleaning. Very toxic. Even if you live in a building where there's a dry cleaner next to you or below you on the ground floor. So dry clean is toxic. When you get it, if you get your clothes dry cleaned, which I don't anymore, I don't even want to go into one of those places. But you better air it out. There's a couple chemicals called TCE and PCE. And they get into the water supply. And most commonly in whales as well. A lot of Americans rely on whales. I have a couple of them on my property. These are bad chemicals that are used for a lot of different reasons, as it's dissolvents and, of course, pesticides and all. They're just horrible. So a little word on treatment. L-dopamine and deep brain stimulation are the mainstays of common treatments for this. Now, they're developing some other things, but for the most part, these are the treatments that we use. But they eventually don't last. You can use levodopa, carbidopa, and that's the first thing you start out with, of course. And there's a few other drugs that we use, but it's the most common and it works. But the problem is it's short acting and you get tolerant to it and it'll eventually quit working. Then you go for the deep brain stimulation. There's just a few centers that do that. I have seen it work for tremors pretty impressively. But in any event, they eventually don't last. I want you to note that this disease is rare before age 40, and it's more common in males. Remember this, estrogen, like I've told you before, has a very neuroprotective effect. So women, that's one reason women don't get it as much as men, and that's one reason women should listen when we talk about estrogen replacement therapy, which, thank goodness, has finally they've removed the black box warning off of the estrogen products, finally, very recently. So you women can have a chance at living a very much better quality of life after menopause. So listen to hormone replacement therapy, something we've been doing for 20 years, is finally becoming more mainstream. There's a lot that they don't know about it. They don't talk much about progesterone or testosterone. So they're in the dark ages even now when it comes to hormone replacement therapy. So talk to a doctor who knows a lot about it. But estrogen is very neuroprotective. And remember, like I've said for years, bioidentical estrogen, estradiol, does not cause breast cancer. In fact, if anything, it prevents it. You have to know how to balance it, what forms to use, etc. Get your mammograms, do that type of thing. But it's very protective for women. That's why women, they're really healthier than men. They just die of the top 10 causes of death. Women die way less from, 9 of them. The only form of death that they die more frequently from is Alzheimer's disease. And that's because of lack of estrogen in a lot of cases. Maybe most cases. Who knows? We think we know. It's certainly one factor in it. There's no doubt about it. And think about bone loss. Think about heart protection. Why women don't have heart attacks before age 50 like men do. They have protective estrogen. And when they lose that estrogen, they get brittle. They can get dementia. They can have heart attacks. And they, not only just the symptoms of menopause and the frailty, lack of muscle. I mean, look at bioidentical hormone replacement. I try to stress that in everything we do. But anyway, so disease is rare before age 40, more common in males. And remember, men need some estrogen, just not too much. Just like women need testosterone, just not too much. Why do men get it more than women besides estrogen? Because men have had higher exposures to pesticides and solvents through the years and heavy metals through the years. Plus, they've had more head trauma. Head trauma does play a factor in Parkinson's. Look at Muhammad Ali. A lot of the foundational work for Parkinson's is done through Michael J. Fox. He's done an incredible service in advancing treatments for Parkinson's and public awareness of it. There's a lot of stigma to having Parkinson's. He's done a great job with this. So, how do we prevent Parkinson's? And that's why I bought this book. As a longevity doctor, I find it really is similar to how you would go about healthy aging in the first place. Living a healthy life. An ounce of prevention is always worth a pound of cure. Who said that? Benjamin Franklin, I think. My mom said it a lot. Anyway, they came up with a Parkinson's 25. 25 things you can do to hopefully prevent Parkinson's. And start thinking about this when you're young. Start thinking about your kids' exposure to things when they're young. So the Parkinson's 25. Wash your produce, even organic. Pesticides, to me, look like the main cause of this. Change your diet. When you eat beef, eat grass-fed, pesticide-free, hormone-free. That's a different kind of hormone they use than the ones we use. Hormone-free. Use pastured chicken. We're going to talk about eggs a lot. Pastured chicken, eggs. Wild-caught fish. Eat organic. Change your diet. Don't get insulin resistant and fat. Toxins are stored in fat. Remember that. Avoid dry cleaners. It's one of the main things I got out of this book is not get near a dry cleaner. Drink wine without pesticides if you drink wine. Avoid diabetes. Much higher risk of Parkinson's if you're a diabetic. And remember, a precursor to diabetes is just insulin resistant. And 90% of Americans are insulin resistant because they're overweight. Check for insulin resistance. We do that with our Cleveland Heart Panel. It's going to predict way before you'll come down with a high hemoglobin A1C or a random sugar. So look at that insulin resistance number on your Cleveland Heart Panel. So don't get diabetes. If you do have diabetes, please control it. Great treatments for it, especially nowadays with all the GLP-1s. Drink caffeinated coffee, very neuroprotective against Parkinson's disease. If you're a farmer, farm safely. Farmers have a way increased risk of developing Parkinson's disease. So do our veterans who've been exposed to a lot of things. Check your well. I had mine checked, even though I use city water plus well water for certain things. Use a water filter. I just got my whole house with a water filter. Carbon for the main line and reverse osmosis in my kitchen. See my podcast on that from a few weeks ago. Use air purifiers. I've used these for years. Don't poison yourself with pesticides. If you work around the garden a lot, you gotta use this. You gotta be very careful about overusing and overexposure to pesticides. I mean, you can even get them through your pet stuff, like flea and tick collars and things like that. Just be careful. Choose your home safely. There's certain areas of this country that are you're very more likely to get Parkinson's. The EPA can tell you safer places to live. Think Chernobyl and 3 Mile Island, things like that. Check your ground floor of your apartment building. Check your child's daycare center. These are all to avoid dry cleaners because they use the TCE. When you're in a lot of traffic, roll up your windows and use the indoor circulation. Garden with care, just like I told you. Be careful of golf courses. People live on golf courses that work on golf courses are more likely to get Parkinson's disease. Wear PPE if you're around a lot of toxins, especially farmers and people that garden all the time. Be careful with this. And, check locally to see how the environmental exposures are in your area. The other things that I always talk about with aging well. Exercise means sweat, detoxify. That's why I love my infrared sauna, which I got in this morning. I like red light therapy too. Get a good night's sleep. Do all the things that you would do for healthy aging. De-stress. Avoid head trauma. Support your veterans. They're at much increased risk for Parkinson's because of all the exposures they've had. I think veterans comprise 6% of our population, but they get 10% of the Parkinson's. So support your local veterans. So I hope this helps you. This is a great book if you want to take a deep dive into it. The Parkinson's Plan. It's a great book. Think about Parkinson's. I know you know people, friends and family that have Parkinson's. So be aware of it and do those things you can to prevent it. I hope this helps. Read the book. I'll see you next week.